you, welcome to Dr. Rights. In today's video, we shall study about the thyroid case. Now we will take up a thyroid case. Consider a 40-year-old female. She has come to your OPD with a neck swelling. Okay, there is a swelling in the neck for last 2 months, which has been increasing in the size. Okay, towards the left side. So, what will you do now? So, as the swelling is present in the neck region, you can consider this to be a swelling in the thyroid gland. So, how will we process now? First, for any case to proceed, we have to take the history and do the physical examination. Now, if a patient is presented with a swelling in the neck, what will you ask about the swelling? You will ask whether there is any pain or not. You will ask more details about the swelling. Now, as this is in the neck region and you can suspect thyroid, or you can just consider the fact that this swelling will press on the nearby structures. So, if it presses on the esophagus, it can cause dysphagia. If it presses on the trachea, it can cause dyspnea. Now, as this is present or associated with thyroid gland, you can consider a hoarseness of voice to be one of the complications or symptoms that the patient presented with. And as I am repeatedly telling, as this is swelling in the neck, you have to ask features of hypo and hyperthyroidism. So basically, we do a quadruple assessment in which history and physical examination is the first thing, which is for every case that you take up. Then there is a thyroid function test, then there is imaging, and then there is cytology. What are the features of hypothyroidism? Features of hypothyroidism include cold intolerance, heavy and irregular menstrual periods, low heartbeat, irritability, and weight gain. And in case of hyperthyroidism, the prominent features that you have to ask for are weight loss, irrespective of a voracious appetite, heat intolerance, sweating, and high heart rate. Now, next, we go to the physical examination of the thyroid gland. Now, as this is a swelling, you have to take it as a case of swelling and do the inspection, palpation, percussion, and auscultation. Now, for any swelling, under inspection, what do you see? You see the size, you see the site, you ask for the onset, the progression, the duration, any skin changes over the swelling, color changes, venous prominences. If you can ask the patient how he or she feels about the margins and the borders of the swelling, the surface of the swelling, you're going to ask all these things. Site, size, shape, any ulcer, any skin surface changes, margins, any other swelling present in the neck or anywhere else in the body. And also you will ask the features of hypo and hypothyroidism, which I have mentioned. In inspection, you're also going to ask whether the swelling moves up and down with degradation. And you will also ask the patient if they can feel the lower border of the thyroid gland. And there is one more point which is not mentioned here. You also have to ask the patient to take her or his tongue out, and then you have to see if the swelling moves up and down. Because if the swelling moves up and down after taking the tongue out, that means it is a midline swelling or a thyroclossal cyst. After inspection, we move to palpation. Under palpation, you have to first check the temperature, the tenderness over the swellings. You have to confirm all the inspection findings. Whatever size, site, extent, margin, surface, which you have elicited in the inspection part, please confirm it in the palpation part. Then, the specific features that you have to see in palpation, apart from temperature, tenderness, and eliciting the inspectory findings, you have to check for the lymph nodes. I have already uploaded a video of the cervical lymph nodes. You have to check for the cervical lymph nodes. Then, you will see yourself for the lower border of the thyroid gland. Okay. Then you will look for the Pemberton sign. What is Pemberton sign? You will ask the patient to outstretch their hand and raise both their hands above their head. If their face becomes red, if there is plethora, that means Pemberton sign is positive. This happens in case of thoracic inlet obstruction, that is seen in case of retrosternal goiter. Now, you will look for tracheal deviation. With the help of your middle finger, you can look for the tracheal deviation and rest your index and the ring finger on the two sides of the sternoclavicular notch. So if this is the sternoclavicular notch, you will place your fingers like this and then you will look for the tracheal deviation. What else to look for in palpation? The carotid pulsation. I've already mentioned about the Berry sign, whether you can feel the pulsation of the carotid artery in its location. That is between the posterior part of the thyroid gland and the anterior border of the sternocleidomastoid muscle. If you can't feel, then Berry sign is positive, which is seen in case of malignancy, yes, and Graves' disease. Lastly, in palpation, you have to check for thrill. Okay. Lastly, percussion and auscultation. In percussion, We will start percussing from lower border up and then go above. If a dull note is seen, then that means a retrosternal prolongation of thyroid is present. Okay? And in auscultation, you have to hear for the bruit sounds. Keep the bell of the stethoscope on the swelling, basically at the upper pole of thyroid, and look or hear for any bruit if present. So this was inspection, palpation, percussion, and auscultation.
Subscribe to the channel, please.